All right, we are going to go ahead and get started. This is week 7 of our 8-week onboarding program. And this week is an exciting week because we get to recap over filler. So super fun. At this point, everyone should have had their launch parties. Mercy. Everyone should have already had their launch parties and feel pretty comfortable injecting patients. Mercy me. Okay, let me screen record and get started. Okay, so this week we're going to go over filler recaps. I'm also just going to ask just some general MFL questions to kind of open it up to everybody, and then also some AR questions, and then we finally have our marketing homework for this week. Okay, let's go over our filler recap. Oops. That's not what I wanted. Okay, like I said, this is going to be a little bit of a longer call, but I'm going to try to condense filler as quickly as I can for you. So this is the exact same PowerPoint presentation that I went over in training. So this should not look foreign to you. Everyone should have this PowerPoint presentation at home. So remember the big guns as far as the vessels that you need to be concerned about with filler. It's going to be the facial artery. Remember, you have your external kind of carotid, and then your facial artery comes up. It comes out a little foramen right in front of your masseter is your facial artery, and it's going to travel up. It's going to angle up. Once you get to right about the oral commissure, you're going to have a part of it that's going to dip down and feed your inferior labial artery, and then it's going to continue on up and feed your superior labial artery. From there, it's going to continue on up to your angular artery, your supratrochlear artery. Those are the big ones in the mid face. And then from your external carotid, it goes up in front of your ear and it crosses over, and that feeds your transverse facial artery. Your mental artery is going to be in your chin. And then you also have your nasal artery, which is going to feed your nose. Any questions on the big guns as far as the big vessels of the face?
No.
This is a side view of that, so you can see exactly how that facial artery kind of travels up. So whenever you're dealing with filler, the big thing is to know what plane or what layer of the skin that you're going to be laying the product in. So the very first layer is going to be your skin. The second layer is going to be that sub-Q area. The third layer is going to be where the muscles are. The fourth layer is going to be that retaining ligament space. And then the last layer is going to be the periosteum. Now, if you have a really kind of low G prime product, you can put all of the low G prime products into layer 1 and 2. If you have a medium G prime product, it's going to be between layer 2 and 3. And if you have a high G prime product, it needs to be laid in layer 4. G prime, again, means the thickness or the viscosity of the filler. These are the fat pads of the face. Remember, at the age of 35, they slowly start to disintegrate and separate. That's also because you stop producing your own natural collagen at 35 as well. The purpose of filler is to add volume back where volume has been lost. We are not trying to create a whole new human being. We're simply trying to give them that original volume that they had. This shows at the age of 35 all the way to the progression of age 55 of what that fat pad does over the next 10, 20 years or so. So you can see by the time the patient is 55 years old, they have a significant volume loss in their face. These are all the different areas that you can put filler, and it can be used for a lot of different things. It can be used in the nasolabial folds. It can be used in the tear troughs. You can do lips. You can do cheeks. You can do hand, chin, jawline. You can do all sorts of different things with filler. Now, remember that it comes in typically a 1 ml syringe with the exception of 2 products, and that's going to be RHA 4. It comes in 1.2, and then also Versa comes in 1.2 as well. It also comes with 2 native needles. Native means that it comes inside of the package. If you're going to be doing a sterile split or you're going to be breaking down or backfill that insulin syringe. You'll put the native needle on, you'll take the butt of the insulin syringe off and then hold the plunger, and then you're going to just squirt the filler into the back of an insulin syringe, and that is called a sterile split. I also do that whenever I do patients' lips because it gives me a little bit more fine tuning ability with that smaller needle. The majority of the fillers that you are going to be dealing with here at MFL are going to be the hyaluronic acid fillers or the HA fillers. They can be naturally dissolved with Hylenex or hyaluronidase. That is the antidote to filler. The other products that we use here at MFL is going to be the polylactic, and that is going to be Sculptra. Sculptra works a little bit differently than the hyaluronic acid fillers. You're going to have to rehydrate it. It does come in a powdered form, and then you're going to shake it, and then you can actually put it into the patient's face. Once you get out of probation and you want to do additional Sculptra training, please let us know, and we can make sure that we have that. I think we have one coming up here in Houston pretty soon. What is G prime? That's going to be the viscosity or the thickness of the filler. The higher the G prime, the thicker the filler. This is that G prime chart. If you're going to be doing someone's mid face or cheeks, I highly recommend Restylane Lift, Contour, RHA 4. Those are going to be like my favorite kind of go-to. I actually just redid my cheeks the other day and I used Contour. I love Contour. I love RHA 4. I love Lift. Lift has a significantly higher G prime product than all of the other products. So just know if you have a patient that has really thin skin, or if they don't have a whole lot of volume in their face, you really don't want to use Lift because it's going to look like boulders. You're going to want to use RHA 4 or Contour because it's a little bit of a softer product. These are kind of my go-to for fillers. What I recommend for all brand new novice injectors is to find one line of filler or one particular filler and stick to it. Once you get comfortable with it, then you can start branching off, but really just kind of stick to one filler so you know how the syringe feels, you know what it feels like whenever you're pushing the plunger. So find one and kind of stick to it. Then once you get comfortable, then you can start branching out into additional ones. These are the medical questions that you need to make sure that you're asking all of your patients. You need to know if they have any allergies or sensitivities, especially to lidocaine, because lidocaine is impregnated into all of the fillers. You also want to know if they've had any previous cosmetic or aesthetic procedures, if they have a chin implant or if they have additional fillers. You need to kind of know what you're going to be encountering. You want to know additionally what medications that they're taking and herbal supplements, because if they are taking something like a fish oil that can cause them to bruise or to bleed a little bit more, you just need to know that so you can prep the patient. Also, if they have a history of cold sores, you do need to pre-treat the patient. You can treat them as soon as they leave. You can call the prescription in, or your telemedicine provider can call it in for them. But they do need to take it, especially if you're going to be doing those lips, because the worst thing that you can do is do someone's lips and then the very next day they break out in a cold sore. It's going to move that filler, and now your beautiful work is going to be uneven. If they do have a history of cold sores, you're going to call in Valtrax 2 grams PO BID times 1 day. If they're pregnant or breastfeeding, automatic no-go. And any autoimmune disorders, we kind of talked about this in training a little bit. It doesn't mean that they can't have anything done. I always just educate my autoimmune patients because their body will attack it themselves. So if you put anything foreign in their body, it does have the ability to kind of react and cause a delayed onset granuloma. This is the physical exam that you're going to be going over. You want to assess the skin texture. You want to make sure they don't have any open wounds. You want to look at facial symmetries. Remember, some people sleep on one side of their face, so they're going to be flatter on one side. It's important that you point that out to patients. You also want to look at the contour of their face and how much volume that they have in their face as well. And then also just kind of take note of their vascular health too. This is going to be the pre-treatment checklist that your patient needs to kind of go over. And if they do have the ability to stop NSAIDs prior to the procedure, a couple of days is usually recommended. Again, that's just so it minimizes bruising. Same with any high doses of vitamin E, fish oil, flax oil, flax oil, anything like that. No alcohol for 24 hours prior. Green tea, coffee, anything like that can also cause some bruising. Vaccines for 6 weeks before or after, because we talked about that in training. If someone's going to be getting a vaccine, they want to get that full effect of that vaccine. So you don't want to do anything that might blunt or mess with their immune response from that vaccine. And so please no fillers 6 weeks before or after. And then no dental procedures 2 weeks before or after either. I think someone's trying to get in the waiting room. Here we go. No dental procedures before or after 2 weeks. And the reason for that, it's because the patient's going to be having some swelling. So you really don't want to do anything that can, one, cause the patient to have more swelling, or two, mess with any type of dental procedures that they're having done.
Okay.
Any questions about that? Excellent. Now, these are the contraindications, meaning these are kind of like the no-go ones. The first one is going to be any blood thinning medications. And this is going to be things like warfarin, Lovenox, Eliquis, Xarelto, kind of like the big guns. If they have an active infection, if they have like a big old pimple on their face, or if they have any type of cellulitis, or if they do have a cold sore, wait till that is healed and has gone away before you try to do any type of filler treatment. And then also any pregnant or breastfeeding women. And then also if they're allergic to lidocaine. If they are allergic to lidocaine, you can request that we get lidocaine-free syringes from the manufacturer. We just need to have a heads up about that. Any questions about the contraindications? These are the common.
I'm in a meeting.
Sorry. These are the common side effects. These are the ones that I kind of go over with every single patient, and that's going to be bleeding and bruising, inflammation, lumps or bumps. I always tell people, don't love or hate your filler for 2 weeks. I really do a lot of education on this because you really don't want to be getting blown up on your cell phone. Someone saying, oh my gosh, I feel a lump in my lips and it's been, 2 days. Give it 2 weeks. If after 2 days they still do have a little residual lump or bump, that's when I'll start having them massage it for 2 weeks, right before and after they brush their teeth. And then if that's not gone after that next 2 weeks, then I'll go in with some Hylenex and I can do some dedicated dissolving. I just don't want to automatically jump to dissolving because lumps and bumps are normal and expected up to 2 weeks. So just prep your patient for that. Tenderness, and then obviously a herpetic outbreak if they have a history of it. We recently had a patient, they did a telemedicine with Lauren, and Lauren asked them, do you have a history of cold sores? And the patient was like, nope, not at all. The very next day, she broke out in a cold sore and called the injector, and the injector was like, I didn't think you had a history of cold sores. And she's like, well, I mean, I don't break out that often. I'm just, only like a couple times a year. So it's like, okay. Yes. So she ended up getting a cold sore, and now she has like a little divot that the doctor has to go back and kind of fix because she has a little bit of asymmetry. So please make sure if the patient has any history at all, meaning even if they broke out once as a child, just call it in. It's no skin off our back to call it in. Bleeding and bruising, very common, and just prep your patient for it. I actually just did my lips as well, and I have a little bruise right here. Wear some lipstick and it's totally gone. Let's talk about the major complications. Infection is going to be something like cellulitis of the face, obviously a vascular occlusion, hypersensitivities, and then granulomas. Let's talk about the stages of a vascular occlusion. Quick recap. Stage 1 is going to be blanching. Stage 2 is going to be that reticular lacy pattern. Stage 3 is going to be vesicles. Stage 4 is going to be skin breakdown. Stage 5 is full thickness necrosis. Now, you notice on here, bruising and pain is not always one of the symptoms, because if a patient does not have pain, that doesn't mean that it's not a vascular occlusion. So pain is plus or minus, but bruising is not a symptom of a VO. So please know that. So we're going to go to the next slide, and we're going to talk about which one is a VO. Let me find it fast. Go back. Here we go. Bruise or vascular occlusion. So what is this picture down here? Is that a bruise or vascular occlusion? The very first one, the bottom left. You can unmute yourself and let me know what it is, or you can say it in the chat. Is that a bruise or vascular occlusion?
Vascular occlusion?
Vascular occlusion. Yep. What about this one, this upper right-hand corner? Or I'm sorry, this very first one.
Bruise?
Very bruise. Yep. Didn't have any, didn't have any of those stages. What about the one right next to it?
Bruise?
Bruise, right? It's just, you only see bruising. You don't see any of the other things. What about this one over here?
VO. Vascular occlusion?
Yep, VO, right? That's going to be stage 2. That's that reticular lacy pattern. What about this one down here?
Bruising?
Bruising, right? Bilateral bruising. And then finally, what is this one right here going up the nose?
VO.
VO, what stage is that?
4?
Stage 3. So that's gonna be the best.
3.
Yep, stage 3 vesicles. This is a lot of times where injectors will think that it's just simply a herpetic outbreak, but this is actually following the vessel as well. So like a classic VO. Okay, so we go back. Let's talk about the 2 types of vascular occlusions. The first one is going to be an interarterial occlusion. This will happen while you are injecting. This means that you accidentally injected filler into a vessel and it immediately stops blood flow. This is when you'll start to kind of go through those phases. Remember that each phase is around 12 hours, roughly. The second type of vascular occlusion is going to be a compression one. This can happen while you are injecting, but it can also happen 24 hours after from inflammation. This is caused by filler getting too close to a vessel or inflammation, clamping down on a vessel and stopping the blood flow. Both are considered emergency situations and need to be addressed immediately.
Or did they, oh, they signed off.
Hylenex or hyaluronidase is the antidote for all hyaluronic acid fillers. Just remember that Hylenex does burn. Do not dilute it. Do not try to, add lidocaine to it or add saline to it. If you do have a vascular occlusion, or even if you were doing, you were trying to dissolve some filler that from like a superficial filler, it's just going to burn. The purpose of it is that you are wanting to delete it, to dissolve the filler. Whenever you dilute it, it just dilutes the medication. So please do not do that. And you will see that all the time on social media, so please don't do that. Okay, this is our vascular occlusion protocol. The very first thing that you want to do is you want to stop injecting. Then I talked about how there's going to be a step between that, and that's going to be take a deep breath and just know that you are never alone during a vascular occlusion. So take a deep breath. Then from there, you're going to vigorously massage. Sometimes you can massage it out, especially if it's just a compression VO and you need to kind of move that filler. We actually had one at training not too long ago. I think it actually might have been this group where they got a little too close to a vessel and the bottom part of the lip turned a little white. They massaged it and it went right away. So sometimes that will take care of it. If that does not take care of it, you just need to flood that entire area where you're injecting with 1 vial of undiluted Hylenex. Remember that it burns. If the patient is allergic to like anaphylactic allergic to bees, you do need to pre-treat the patient. So just know that with some Benadryl. And then you, at that point, if after you've flooded that area, you're then going to continue to kind of massage and then wait a good 5 to 10 minutes. If you get color change back, then you're done. If you don't, at that point, you have to try to cannulate the vessel and then you'll do an art stick for that area and then flood it with 1 vial. And then you're going to continue to massage and do some warm compresses. The patient will then need to take 325 milligrams of aspirin. We will prescribe Augmentin, typically 875 PO BID for 10 days or something similar for cellulitis. And then the patient is also recommended to do hyperbaric treatment for 4 treatments minimum. Each session is, I believe, 1 hour. As far as treating infections, we kind of treat it both ways. We'll do steroids and we'll also do antibiotics. If we're going to prescribe steroids, it's 60 milligrams of prednisone, PO QID for 3 days. And then this is kind of the antibiotics that we have the ability to choose from, depending on the patient's allergies, if they have any. Retinal occlusion protocol, the biggest thing is the patient needs to be taken to the highest level of hospital care possible. So you're going to take them down to like the kind of big ones. So if you're in Dallas, Parkland or Baylor, if you're in Houston, Herman, Ben Taub, any of those. And then you hold pressure on the patient's eye and then take them down to the emergency room. If this does happen, the chance of regaining eyesight, it's like less than like 5%, and it has to be done within 15 to 45 minutes. So the big thing here is do not inject noses or glabellas. Just do not do it. There was a girl on Instagram or TikTok the other day, and she was injecting a nose, and the patient, or she was reading had what happened. This injector injected some lady's nose, and she said she immediately felt like something went into her eye while she was doing a liquid rhinoplasty, and the patient went blind in her eye. So please just do not do noses and glabella. You will see it all over Instagram and TikTok. Please do not do that. Hypersensitivity reactions, the telemedicine provider, or if you're an APC, you will simply call in prednisone 60 milligrams PO Q day times 3 days, and this will knock it out. Biofilm, we talked about this in training. This occurs really because of 3 ways. Hand hygiene, or the patient was not cleaned properly and a bacteria was inadvertently injected into the patient. Patient selection or product selection. Patient selection, it's more of those autoimmune patients, and then product selection, the Vycross products do have a higher chance of causing this, but we no longer carry those in MFL. The Vycross products are going to be Voluma, Volor, Velox, so the Juvederm line. Non-inflammatory nodules. These are going to occur typically because the product was laid too superficially. So please make sure that you are injecting in the correct plane with the correct G prime product that should be going into that plane. Meaning you would not inject a high G prime product, meaning like Restylane Lift, into layer 1 of the patient's face. That would immediately cause a non-inflammatory nodule because the product was laid too superficially for the associated G prime product. So please make sure that you are choosing the right product with the right plane of the face. Filler migration. So this occurs in really 2 areas that we see the most, and that's going to be lips and tear troughs. Tear troughs is considered a very advanced procedure, excuse me, and there's not a whole lot of patients that are true candidates for tear troughs. Usually you can fix the tear trough region of a patient by just fixing their mid-face, meaning just by treating their cheeks. That will help with the tear trough. For lips, you do want to make sure that you are, if you are going to be doing the outlining of the lips, that you are directly on or right underneath that vermilion border. If you are above the vermilion border, this is what happens. All that product gets laid above, and you have significant filler migration. So if this patient came to us, and she wanted more filler, we would simply say, no, girl, we're going to dissolve and we're going to start over. After you dissolve, you do need to wait 2 weeks after you're dissolving in order to refill the lips. Okay, let's talk about how to stay safe. You always want to make sure that you aspirate with every single injection that you do and count to 6. So 6 1,000. So 1 1,000, 2 1,000, 3, 4, 5 1,000, 6 1,000, and you're going to do retrograde injections. Leave that plunger there, watch that plunger move, and then slowly start pulling it back as you are doing retrograde injections. And this is something that you can practice at home. You can take your insulin syringes and really just kind of practice with your head. Put the needle into your little plastic head, and then work on the speed of which you are drawing back. Make sure you know your anatomy and watch for color change as you're injecting. You also want to do slow, steady pressure, and you never want to do more than 0.2 in any individual spot. The only spot that really has 0.2 is going to be the mid face, and it's that very first injection point that's kind of directly below the pupil 1 centimeter over. Remember, we do that 1 centimeter over, so we miss that interorbital artery, and that kind of buys you a little bit of safety. That's really the only spot on a female that you'll be doing 0.2. For a male, you can do it there. You can also do the 0.2 on the chin. The chin can handle it as well, but please make sure you're aspirating like we had talked about. Everything else is going to be less than 0.1 in each individual injection point. You can simply put 0.1, pull out, go to a little over, and then put another 0.1. The reason why you do that, it also helps prevent you from hitting a vessel or causing a compression, vascular occlusion as well. This is going to be your pre-procedure checklist. You're going to do your patient assessment, you're going to do your consent, you're going to do your procedure prep, and then you're going to prep your patient. And by prepping your patient, I mean clean your patient and then draw exactly where you want to go on your patient. That is the hardest part of aesthetic injecting, is to plan out or map out exactly where you want to go. So draw dots on the lips, draw exactly where you want to go. That takes the guesswork out of it. That way you can simply kind of color in the lines or kind of, inject where you have already kind of planned out. For a post-op, you want to tell the patient to avoid strenuous exercise for the next 24 hours. They can do a cool compress. Don't tell them to do ice because there is lidocaine impregnated into the products. And so it can cause a freezer burn and they won't even know it because they're going to be numb still. No makeup for 24 hours because they're going to have holes in their face and you don't want to cause cellulitis. No facials for 2 weeks until the inflammation is gone. Another reason for no facials is because if they went that very next day, not only are they swollen and it's going to be tender, but that esthetician could actually move that filler around. So please no facials for at least 2 weeks. And then they can use arnica for bruising as well. So I have a little bit of arnica that I'm going to be putting on my lip right here, and that will cut my bruising time in half. Arnica comes in 2 forms. It is a gel that you can buy. It is also sublingual tabs the patient can take underneath their tongue as well. I like using the gel because I can kind of like put it on there and massage it. So I love the gel. Okay, let's talk about some of the big areas that we do inject. So these are kind of the foundational 4 areas that we went over in training. So the very first one is the cheeks. Okay, so you're going to draw 3 lines. The very first line is going to be pupil straight down. The second line is going to be lateral canthus straight down. The third is going to be tip of the ear to the tip of the nose, and you're going to kind of cut all the way across, making sure you bifurcate the apex of the cheek. That's the most highest point of the cheek that sticks out. Your very first dot is going to be 1 centimeter up that line because your infraorbital artery is traditionally directly below your pupil. Know that every single patient is different. Your next dot or your next injection point is going to be right at that cross where those lines intersect. And then your third one is going to be 1 centimeter up that line. That very first dot is going to be your 0.2, the next one 0.1, then that final one is 0.1. Remember that it's 90 degrees in. You're going to grab a hold of the hub with your other hand. You're going to put your thumb and you're going to aspirate for 6 seconds. Then you're going to put your thumb on the plunger and put 0.2. The whole time that you're holding the needle with your non-dominant hand, so you're not putting pressure on that patient's face because you can bend the needle because the needle is very thin. Take it out, and then you're going to go directly in for the next one. So 0.2, 0.1, 0.1, a total of 0.4 on one side of the patient's face. You're then going to repeat that same procedure on the opposite side. So now you have used a total of 0.8 because 4 plus 4 is 8. So in a normal 1 ml syringe, you should have 0.2 left. That's really why I like RHA 4 is because you have 1.2. So now I don't have just 0.2 left. Now I have an additional 0.2. So I have a total of 0.4 left that I can go back in and tweak. So the patient gets a little bit more bang for their buck. If my cheeks look great, then I'll typically go to the piriform and I'll go 90 degrees into the piriform, aspirate, and then put 0.1 on each side, and that will kind of help pop up that nasolabial fold as well. Please make sure you are using the entire syringe. We do not keep syringes for patients. That is not sterile, so we do not do that. The patient must use the entire syringe. If they just want half a syringe, you can totally do that. That's fine, but we do have to dispose of it. If the patient is getting their lips done and they only want to do half a syringe, we do sell a half a syringe, and that is the Restylane Eye Light. So you can request that, and that is a half a syringe of filler. So this is for the nasolabial fold or those piriform injections. Again, you want to do a total of 0.4 on each side of the face. If you are going to be using a cannula, you're going to do your pilot hole kind of down here and then thread up your cannula and lay a total of 0.4 in one kind of long linear line. If you aren't going to be using a cannula, you can do kind of the tic-tac-toe cross-hatching method, and each individual line is going to be 0.1. Same thing with the marionette lines. In training, we taught you the line and fill method, and this is actually, I use this method all the time. Even for Julie Horn, if I'm going to be doing the fencing technique, I will still literally outline the lips and they look exactly like this. I just did this the other day. So please make sure you are drawing or mapping out where you need to go, and you're simply going to connect the dots. Each dot or each line is going to be 0.05. This is why I like to backfill my syringes whenever I'm doing someone's lips, because it makes it significantly easier for me to do. Now, do note if you are going to be backfilling a syringe, then if you use a medium plus G prime product like Restylane Kiss or even RHA3, it is harder to push, but Refine, Redensity, RHA2, Versa, it flows through it like butter. But just know if you do use Restylane Kiss, your hand is going to shake of how hard you have to push. So I usually recommend using the native needle if you're going to be using Restylane Kiss. For chin, you want to make sure that you're going to stay within the normal male and female anatomy. For a male, you're going to mark from the oral commissures going straight down. Female, it's going to be the tips of the nares straight down. For a male, each injection point, there's going to be a total of 5 injection points, and it's going to be 0.2, 90 degrees in, all the way down to the bone. For a female, you can see it's only 4 injection points, and they're more kind of this diamond pattern because, again, you want to stay with that feminine anatomy. And I usually do 0.1 in each injection point. Now, that doesn't mean that I'm totally done after I've done only 0.4. I can go back and add more in each of those injection points, but I only do 0.1 at each time, but I will use the entire syringe. All right, that is it for our filler recap. Okay, any questions at all on filler?
And this is Leslie. I have a question.
Yeah, what's up?
So you mentioned hyperbaric therapy in case someone does have a VO, and I hope that doesn't happen to any of us.
Sure.
How do you help a patient in that process to get HBO therapy?
Yeah, at that point, we have to get insurance involved.
Okay. And are you just looking for centers in your area at that point?
Yeah, and we have several kind of connections, especially in Texas. I mean, all the way down from the Valley, all the way up to, to West Texas, up in Dallas as well. So we have connections with several different places. We've only had to utilize it twice, and it wasn't within MFL. It was actually with my other company where I fixed people's mess ups, and so I utilized my connections that way. But within MFL, we've never had to do it. But God forbid it does happen. We have resources available for you, and we will help navigate through that with you.
Awesome. Thank you.
Yep. Any other questions? Has everyone at this point, everyone should have had their launch parties, correct? Leah, you had yours, you and
Yeah,
yep. How did they go?
they were good. They were fun.
Awesome. Good.
I have mine on Friday.
How did it go?
Oh, I have mine on this coming up Friday.
This coming Friday. Got it. Okay. Well, good luck. You're gonna have so much fun. Who is your onboarding specialist?
It was going to be Ashley, but she was not available that day, so I forget her name. But I just got an email with, is it Heather? Let me see. Check my email.
I had mine done today.
How did it go?
It was really good. It just finished like a couple hours ago. Like it was 1 to 4, but it was good. I had 3 people, and it was successful. I passed.
Good. Very good. Good job. That's all we ask, right?
Yeah.
So
Yeah, it's Heather Branch. Sorry.
oh, she's lovely. You're gonna love her.
Thank you.
Awesome.
I
So
will have mine on the 25th.
yours is on the 25th.
Yes.
Very good. Well, good luck. After you have your launch parties, I usually tell people to kind of go in on like social media and say, hey, I'm going to give away 10 free lip flips, because people see free and they see a number and they're like, oh, I want it. I want it. I want it. That's where you use that Jeuveau coupon. Remember, they get $40 off for brand new patients, and it's every 90 days. Do a lip flip with only 2 injection points. So kind of what I taught you in training, the 1-in-1, right? So 1-in-1. And then do a $15 appointment fee. The lip flip is free for the patient. And you also get paid on it. So
Where do you get the coupon at? Where's the coupon?
it's in aesthetic record. It automatically pops.
Oh, okay.
Yes. So it's with Jeuveau. So use that to build your patients up. And you can like tag me in it and I'll comment on it. Be like, oh my gosh, I want this or whatever. This is networking and this is marketing. Okay. So this is how you're going to build it. The the different manufacturers offer coupons, use them to your advantage. If a patient wants to use Botox or Dysport, that's totally fine, but they'll have to pay a little bit. With the Jeuveau, it's totally free. So, and you can do that once a month. I mean, just go and say, hey, you know, I get 10 free lip fits this month. Who wants it? And then you can slowly start building your patient up that way. So please utilize that. So that's kind of for MFL.
Do the lip flips count towards the initial 3 that we need?
Yes, they do. Yes, but you
Okay,
couldn't
thank
just
you.
you couldn't just do 3 lip flips. It would have to, because the purpose of the launch party is really so that onboarding specialists can see you inject other areas. So you do have to do like a glabella and frontalis. You do have to do, you know, kind of full face, you know, some patients. But then after that onboarding specialist leaves, I mean, you can do as many lip flips as you want.
Okay, so she needs to observe glabella and frontalis and crow's feet, all 3 of those, or?
Yeah, I mean, because the purpose of it is really is to help you out, and so that we can watch you inject, and you can ask questions, and so you feel secure in injecting independently after that launch party. So you really want to make sure you're utilizing that onboarding specialist for that.
Okay, great. Thank you.
And I have a quick question.
Yes, ma'am.
Somebody's asking under eye Botox. Do the under eye Botox?
Are you talking about for jelly roll?
Yeah.
Not as a novice injector, no.
No? Okay. Alrighty. Thank
Yeah.
you.
When once you get a little bit more comfortable, because that injection is different. Because if you inject at the wrong angle, you inject into the globe of the eye.
Oh, okay. Okay, I got it. Another question. So stock transfer. So I did a stock transfer, but then the other injector only wants like 4 units. She doesn't want now transfer whole my other Botox. So is that okay? I just gave her 4 units transfer and then I keep it?
No, you have to transfer the whole bottle.
Oh, so
Yeah.
she insisted me to only give her 4 units. So I just gave her 4 units.
How did you give her 4?
Because we drew syringe because I said, I don't have a client, so why don't you take a whole? And she keeps saying, I just need the 4 units.
So the only way that you could do that would be if she actually has to draw it up. So you would take the bottle and then
Yeah.
you would stock transfer the bottle, and then she would take the unit and then she would stock transfer it back. But you can't just say, you know, it would have to go back and forth.
Oh, okay. Oh, I'm sorry. We done that yesterday because she keep asking. I asked her give a whole thing. She said she only wants 4 units.
And that's okay. You just
So,
need to, but in the system, that's what I'm trying to say. In the system, you have to transfer the bottle back and forth.
okay.
Yeah.
Shall I go back and do that way, or I already just transfer only 4 units to her?
That's okay. Just know going forward, it needs to be done that way. And it's just so we can track it.
Okay, alrighty. Thank you.
Yeah, you're welcome.
I have a question.
Yes.
So for RNs who have to go through telehealth with our patients, we're only having to do telehealth if it's a new client or a dose change. Is that correct?
Yes, ma'am. Yep.
Okay. I was just curious because like on the WhatsApp, I've noticed that a lot of people will say like repeat client, no dose change at this time. I'm like, do we have to do that?
So that's only if it's been 11 months.
Gotcha. Okay.
Yeah.
Gotcha.
So that's they've been injectors with us. That the patient is up for renewal. It's every 11.
Okay. And then I have one more question. I had somebody ask me, they had their masseters done at a doctor's office like a month ago. Do they have to wait 90 days to do their glabella with
No.
us?
No.
Okay. Just they have to wait 90 days to redo, like if they got their glabella done, they have to wait 90 days just to do that.
Yeah, just don't make it a habit. Really, that's really the purpose of it. And just that's really just education to your patients of saying, hey, you don't want to be like, do your masseters this month and then next month do a lip flip and then the next month do glabella. Then 2 weeks later do
Gotcha.
So I mean, a couple of times that's totally fine, but just educate your patient of, hey, you really don't want to be doing it more frequently than every 90 days because it can increase the chance of developing antibodies to those accessory proteins.
Okay, that makes sense. Okay, cool.
Yep.
Thank you.
Any other?
And I have a question.
Yep.
This is Leslie. I'm playing catch up. I'm sorry, I was out of pocket last week, and I was listening to the recording about, let's say, I've gotten product transferred from someone else, and I've drawn it up, and there's a discrepancy just by a few fluid units. and I listened to, okay, that could happen with evaporation, various things. Who is the best person to notify when you notice that discrepancy so that can get changed in the system?
Great question. That's Stephanie.
Okay. So
Yep.
anytime I have a product discrepancy, like those few millimeters or
Yep.
few fluid units, I'm sorry, I would just contact Stephanie and say, hey, this was different. Can you correct it for me?
Exactly. Yep. And that is
Awesome.
normal and expected because there is evap, and then some people kind of flick some units out. So know that there is already kind of industry standards as far as like evap. It's around 5 to 6%. So that is kind of normal and expected for us. So we know that. So don't feel like, oh my gosh, they're going to fire me, I'm missing a unit. Like it's not that. So just
there was a little bit of panic. So it's good to have heard that, and I wanted to confirm who I contact. So thank you.
absolutely, yes. And please, what I always kind of stress to everyone is communication is just so incredibly important. Meaning if you accidentally break a bottle or you left it in your car or whatever, just let us know and then we can help take care of it. It's it's really the people that try to not communicate with us, then that's kind of where issues kind of come into play. So this is the job. So please just make sure that you're communicating and we will really kind of help work through anything that we can. I did have a injector the other day. We actually had to let her go because of this. She did not have any bacteriostatic saline on her. And she actually lived in the Houston area. And so we could have gotten bacteriostatic saline to her literally within like 30, 45 minutes, like super fast if she needed it. Instead, she ordered it online from Amazon and then reconstituted our product with it. So she actually had a couple of days because she ordered it online, got it in from Amazon Prime, and then used that bacteriostatic saline from Amazon, reconstituted one of our bottles, injected it into the patient. The patient said that it burned a lot. And then the injector then took that product and then injected herself with it. And she was like, yeah, it burns. I have a little left. What should I do with it? We obviously had to let that injector go. Please do not buy any types of products on Amazon or at a pharmacy, anything. We provide everything for you. So please don't feel like you have to be purchasing anything at all. But please don't do anything that could, potentially hurt a patient. So that was kind of like a big thing. Since 2016, and we've never had that happen. But I guess there's a first for everything. So please do not do that because we did have to let that injector go. So the patient was fine, and so we followed up with the patient and the injector, and had to get medical affairs involved from all the manufacturer and contact like the Amazon place where you got it. So it was kind of a big headache for us. So please do not do that. But everyone ended up being okay. So no one's going to do that, right?
No.
Did everyone's eyes get really big when I said that? Like, oh my gosh.
Yeah.
Yeah, please don't do that.
So, and I have a question. So how about glove and syringe and gauze?
We
Is it-
provide all of that for you.
Oh, so I just have to request from Stephanie?
Yep, it's on the order form.
Okay, all right. Thank you.
And for gloves, they will actually kind of keep track of like how much that you're ordering too. So if you have if you're ordering gloves, obviously we'll provide gloves for you, but like if you order a box of gloves, I think it comes with like 100 gloves or something like that. You don't need to order like 5 boxes of gloves. So just know that we'll, kind of, keep an eye on that. So please order just what you need. But yes, everything is on the order form and we send it to you.
So how do I get the order form? It's AR, a study record?
The order form?
Yeah.
It's on the Facebook group.
Oh, Facebook group. Okay.
Yep,
All right,
there's a
thank
link.
you.
Yep, just type in
Okay.
order form and then if you search order form, it will pop up. It's also in Bamboo as well.
Oh, okay. Thank you.
Any other operational questions for MFL?
Just to clarify, it is okay to use oh my gosh, I forgot the name of it. The stuff that we can put over the Arnicare gel. We can get that from Amazon and use it, or is that on the order form?
No, yeah, you can get your own arnica. Yeah, absolutely. And honestly, I tell patients to get the arnica themselves.
Okay.
Like I keep one bottle or one little tube of it in my injecting bag, and then especially my like kind of veteran filler patients, they actually will. You know, I tell them just to have arnica so they can have it at home.
Okay, thank you.
Yep. Okay, now let's talk about aesthetic record. What aesthetic record questions do y'all have?
I have a
I have-
question. If no one.
Oh, you can go for it.
Okay, thanks, Lydia. When I noticed, like with pricing, if a patient gets more units of a product, it should be knocked down in cost.
Yes, you have to make sure you choose the appropriate tier.
Okay, I was having trouble finding that under the product selection guide, so I'm assuming I just needed to look at it differently, or would that then go under like the special pricing?
It goes underneath the variant. So at the very top,
Okay.
it says product, variant, and then retail. So make sure if they do qualify for a tier, then it is under variant.
It's under variant. Okay, thank you for that clarification.
Lydia, you had a question?
Yeah. So in aesthetic record, whenever I go to provider's room, there's a couple or multiple, I guess patients, like some were tests and some were like duplicates that I accidentally made whenever I had previous patients. Is there a way to delete those just so they're not there or they're just there?
Yep, no, absolutely. So actually, you can go into AR on the app, and then you can find that patient interaction. You can delete it. In the upper right hand corner, there's a little trash can when you click on the patient's profile. So go
And
into.
I do.
Sorry.
Okay.
If you go into the app and you click on that patient's profile, you find that procedure you want to delete, you click on that procedure in the upper right-hand corner, there's a trash can, select it and it'll delete it and it'll go away from your back office.
Okay. Even if it was like a patient that I did do, but for some reason there's a duplicate, it'll delete the right one.
Did you check the patient out?
Yeah. So for some, I guess like my phone was having issues. So I had to like start over, like whenever I was uploading images, and it counted it as like two different patients. So I did check them out, and then I submitted or I sent off the correct ones, but then they had like a duplicate one there. And
What's
it's just,
what's the patient's last name?
there's three. There's LeBlanc, Santos, and Jaquez.
Okay, maybe that's Santos. What's Santos's first name?
Delia. Oh,
Okay.
I see what you're talking about. Where there's like nothing there, I can just hit the little trash can.
Yeah, you see the little trash can button right there.
Yeah.
Yep,
Sorry,
click
my dog is terrible.
That's right. And that will delete it. That's how I do it too, especially for the test patients.
Yeah, okay, cool.
Yep. Any other AR questions or what you got?
I have one actually. Whenever we create the dot phrase from the note, I have a hard time getting there. Where we really press on the screen.
Where it's are you saying you're having a hard time getting the dot phrases?
Yeah, that phrase. Yeah, I have to try several times to get it.
Hit 1, 2,
So,
3 on your phone. If you hit the bottom, I'll show you. So if you click on view notes,
uh-huh.
okay, can you see my screen?
Let me see if I can.
My screen.
Yeah, I see your screen.
Okay. So you're gonna select on it, and then it pulls up this. You see where it says 1, 2, 3 in the very bottom of my phone next to the smiley face?
Oh yeah.
Hit that, and then
Uh-huh.
and then there's a period button. You need to hit the period.
Oh, then it comes up because okay.
And then once you hit the period, I hit that period, and then those populate.
Oh, okay. Thank you so much.
You're welcome. Any other questions? Perfect. All right, so this is your marketing homework for the week. You are going to do a Facebook or Instagram live or reel. Okay, so really asking you to step out of your comfort zone. It can be anything. It can be an education post. It can be you injecting. It can be, you just talking, whatever, but some type of Instagram live or reel. The second thing you're going to be doing is you're going to post a before and after of cheek filler, and I have that graphic for you, so I will upload it to the Facebook page. And then the very last education post that you're going to do is you're going to do a post or education post about how the face ages. So you can start educating all of your audience of, at the age of 35, fat pads start disintegrating and separating. You start losing collagen. That's really when filler kind of comes into play. And you can help rebuild or bring volume back to the face. This is a post you will create on your own. The purpose of it is an education post. So you're going to post a total of 3 times this week. The first is going to be an Instagram live or reel. The second is going to be a cheek filler before and after. I will provide you this. The third is going to be an education post that you will create on your own. And then you're going to continue your aesthetic social media following. And the first one is going to be aesthetic_injector. And then the next one is going to be injector Kens. Again, all of these people, a lot of them do advanced techniques. Some of them do a lot of them do a lot of education. They also kind of give you an idea of how you should be marketing yourselves as well. So immerse yourself in this world and continue to follow and add more tools to your tool belt. And that is it for this week. I'm going to go ahead and I'm going to stop recording.